So thanks everyone. We sitting at the moment on 106 active cases, so that's another 9 people who tested positive in the last 24-hour reporting period. Already today we're seeing more people testing positive again, so there'll be additional new cases reported tomorrow. So once again, you know, this virus is spreading through the community. It's highly transmissible, and we're also seeing a number of people becoming unwell pretty quickly and requiring hospital care and or transfer to Melbourne for a higher level of care that we're unable to provide at GV Health. So from that point of view, in terms of trying to keep the outbreak contained and ultimately bring it under control, there's 2 things that we really want people to do. And the first thing is, if you haven't been vaccinated, please make an appointment to get vaccinated straight away. It's going to be the only thing across the whole country that is going to contain COVID overall, and we really call on the community to, if you haven't made an appointment, to book an appointment straight away today. Don't put it off, and there's plenty of appointments available locally and right across the state, and appointments can be booked on the coronavirus.vic.gov.au website, and also 1800 675 398. The other thing, of course, is that if you've got any symptoms of COVID-19, get tested straight away and don't put it off. We're seeing in our data from the testing stations across this outbreak that on average people are leaving it between 2 to 2.5 days from when the onset of symptoms occur to going forward and getting tested. So please don't delay that. What that can do ultimately is spread people are infecting their household members, their loved ones, other people in the community with COVID by not coming forward and getting tested straight away. So as soon as you notice any cold or flu-like symptoms or gastrointestinal symptoms, diarrhoea, nausea, vomiting, come and get tested and don't put it off. In relation to our day 13 testing program, so our data modelling is now really well progressed and advanced. At this stage, we believe there'll be in the order of 4,000 people on Thursday that are going to require their day 13 test. The day 13 testing information we're communicating out to schools, but with that amount of people, we're really carefully and well planned in terms of additional testing capacity across the drive-through locations, and also we'll have an additional walk-in testing capacity on Thursday, and we'll share all of that information on our Facebook pages, GV Health Facebook pages and the like as well. So a couple of things in relation to Thursday. As I said, 4,000 people are going to need testing. Please be patient. We know that that's a lot of people to test in a particular day. We're confident we'll have enough capacity. We've, as I said, pretty carefully modelled that. What we're asking people to do though is to, as I said before, keep an eye on the Facebook pages and information that's being communicated through the school networks, because most of the people who are going to need to be tested are from the school exposure sites. A couple of things to note on that front is that it's only the primary close contact, or in this case of a school, it's only the student who needs to get tested, not the whole household, unless there's people in that household that have symptoms, of course, but generally we expect it's only largely going to be the primary close contact who will require testing. In terms of how we're going to manage that demand on Thursday, specifically we're asking students from Boucher Street Primary, St Mel's Primary and the Greater Shepparton Secondary College campuses of Maguire and Wanganui in the year levels 7 to 9 to come forward for testing. All of those schools that I just mentioned to come forward for testing from when the testing stations open, which is generally about 8 a.m. until 1 p.m. And then in the afternoon until we close and we get through the demand, what we're then asking is years 10 to 12 from Wanganui and Maguire campus, and also all of the Notre Dame Knight Street campus to come forward for testing from 1 p.m. That information again will be on our Facebook pages. We'll make it freely available. We'll also have already shared that in terms of formal letters and the like to those schools that I just mentioned, and it's moving through that. So hopefully, again, There's lots of people working really hard across those testing stations, have done for the last week or so, and will continue for the coming days. Please be patient, give them a little shout out maybe as you go through for testing. They are keen to make the lines flow as quickly as possible, so please just be mindful of that, and perhaps definitely ask people to be patient, but bring a book, listen to the radio, bring something to eat and drink just in case there are some longer delays. We'll also be having people spread across those testing sites, and they'll be communicating with each other about what the demand is across in terms of queues and people lining up at the various sites, and we'll be trying to direct people and manage that demand and level it out so it's not too long at a particular site where we've got shorter queues at another site. So again, more information will flow about that in the coming days, but we're confident we'll be able to get through it. In relation to staffing and the impacts at GV Health, we have 474 staff currently furloughed. In the last few days that number's reduced from about 530 at its peak, and pleasingly we're starting to see more staff return to their normal work, and just pass on my thanks to all of GV Health staff and all of the health services and other organisations across Victoria that have sent staff to support the effort in the Goulburn Valley in recent weeks. Thank you. Happy to take some questions.
How many people do you have in hospital with COVID-19 now that the Shepparton outbreak, either in Melbourne Hospital or here at GV Health?
I don't have access to the information to the people in Melbourne, but at the moment there's 3 people at GV Health admitted with COVID-19.
With the numbers somewhat staying the same over the last couple of days, are you feeling more confident you've got a better picture of what's happening with this outbreak?
It is a bit, it's still contained. I think the issue is that we're still seeing people testing positive. Those cases are all linked except one example where the interview process is continuing today, but it's feeling like definitely it's a bit more contained. But while we have this number of active cases, obviously over 100 now, and people still testing positive, it is of concern. So anyone who's got the symptoms, come forward and get tested and don't put it off.
In terms of the mid-quarantine testing and any day 13 testing you've done so far, have you seen any positives come from that? No, not that I'm aware of. So, but just in relation to the day 13 testing, we are expecting, based on what's happened at other parts of the state in terms of day 13 testing, that there is likely going to be some additional positive cases as a result of that. In terms of day 13 testing, there's 2 things people need to do in relation to that. Is they're likely to receive 2 communication messages, one about their negative result, hopefully they get a negative result. That's not the permission for people to leave and end their quarantine period. There will be either a follow-up text message or an email from the Department of Health that will then authorise them to be able to leave their quarantine period at 11:59 on day 14. So it's really important that people just don't take into consideration when they get their negative test that the quarantine period is over. That's sort of step 1 in relation to that part of their quarantine, but step 2 is the formal official release from quarantine, which will come from the Department of Health.
Will that come in the form of text messages?
It'll be either a text message or an email or a letter, but definitely the thing for people to look out for is that it has to be from the Department of Health, not their negative test result from the pathology company.
Are you able to tell us more about the new drug that's being used to treat some COVID patients?
So we're able to administer sotrovimab, where we've got the procedure and the processes in place. We've got staff who are trained and ready to administer it. We haven't had patients eligible. It's really quite strict in terms of the eligibility criteria to administer that drug, and it has to be given within a certain window of time within the first few days of someone testing positive. So a few things need to be in place from an eligibility perspective, but we certainly are ready to administer that medication or drug if we need to.
How many tests have been conducted since the outbreak began?
So we'd be in the order of 22,000 tests to date, which is great. So again, that's well over 40% of the Shepparton and Mooroopna population. So thanks to everybody who's come out and got a test, but we've still got a little way to go from a testing point of view in the coming few days.
In terms of those exposure sites where you're concerned people still had to come forward to get tested, are you seeing an increase in people coming forward now?
A little bit. We're still encouraging people to come forward from the Sky Salon hairdressing studio in Vaughan Street, Shepparton, and also the Sir Ian McLennan Centre and the Central Park recreation facility and the function centre of that particular venue. So those details again are on the Department of Health's websites, but those 3 areas or 3 exposure sites are the ones we'd still like some more people to come forward for testing from.
Is testing still high in areas such as Goulburn and Echuca given what's happened there in the past few days?
I haven't seen what their testing volumes are, but I believe they did have a spike in Echuca in relation to what happened, but it's perhaps levelled out. But the exact numbers, sorry, I don't have them.
Is there any outside sort of your Shepparton and Mooroopna, any additional tests that have come through on those 9 today to further afield, like Goulburn or?
No, they're all people that have been in quarantine and all linked to the Shepparton outbreak.
And how many households have we got now?
We're in the order of over 40 households now that are involved in this outbreak.
Are you still doing work in terms of how this outbreak happened and the linkages and that sort of thing?
We haven't. I haven't seen what the latest work of the public health or epidemiology people are. That's being tracked through the Melbourne contact tracing or public health unit. But I'm so sorry, I can't answer that particular question.
Can you just explain with those numbers of how many active positive cases there are by count of how many people have gone through? I think we were up to 112 on our count.
So what happens in relation to why it's not, say, a straight number for the 24-hour reporting period on top of the cumulative or running total is because as people are transferred to different areas for care, or how the outbreaks are classified in some of the other areas, the numbers will vary because of that. So it's largely for us the variations caused by the people we've transferred to Melbourne for additional care, and then the management of them as an active case as such is picked up by the public health unit where that hospital is based.
So just to confirm, report 105 cases you said?
106 we're tracking, and there's more people testing positive, as I mentioned today, a small number so far during the course of the day.
Do you know if those people who are tested positive today, are they still in quarantine as well? Is that your understanding?
I haven't had that information yet. I've just had advice that there's been more people testing positive, but we would expect, based on what we've seen so far, that they should all still be in quarantine. Okay, so Peter Harriott, Council CEO Greater Shepparton City Council, will speak next, and Deb Abbott's available as well.
Thanks, Matt. Fair to say we're in the middle of a serious and significant emergency effort here in Shepparton. As I said on Friday night to the community forum, I believe the community should be quite confident and quite proud of the response that is going on. It's quite professional and in other ways quite inclusive of many people in the community. It's in 3 parts basically, our response. There's a response component, a relief component and a recovery component. They're all at different levels, but the response is obviously the first component, and that's been headed by the Department of Health. Matt and his team are vital to that, and you're seeing that roll out in the testing stations and the vaccination stations to some extent. So that's been as professional as you can get, and supported by some key people in Melbourne. There's daily meetings where we work on all issues. All the agencies come together and any issues are reported up and resolved as we go. In relation to the relief, again we're meeting on a daily basis in relation to relief, and we believe that the relief component has plateaued. And we brought in some assistance over the weekend to help us with the relief component and other aspects, and Deb Abbott from Emergency Management Victoria and her team have been here and done a fantastic job. Today's a little bit about talking about the transition. They've come in to deal with a peak load and have really assisted in ensuring that our food relief, for example, has been an efficient process. They've helped us model that, helped us work with the community, because as you can appreciate, it's not just one sort of authority that's providing relief, it's many, and we've had Red Cross. We had the issue with the 1-800 number, which was a bit delayed there for a while. So through support and messaging going up through the system, greater resources have been provided to the 1-800 number, and I rang that on the weekend and it was 26 seconds to get through. So a really good response from everybody we've asked for, including Deb and her team. But as I say, the load in the relief is plateauing a bit. The number of food packages requests are reducing. So it's time to transition and for us to move eventually into a recovery mode, and our recovery teams are meeting already, and that'll deal with different aspects. There's going to be a number of recovery issues that we need to deal with. A whole range of mental health issues and families that have been locked away for a long time, and they're wondering about financial support. It's not only families, it's businesses. So there were business forums yesterday to deal with these sorts of things. It's about students and how they can handle the next period leading up to exams and those sorts of things. So recovery is so important, and Council's quite confident that there's a good team of people and agencies gathering at the moment to do that. So in summary, we're quite confident, we're comfortable with where we're at the moment. Matt said we're still in the middle of a serious incident, and we need to stay sharp and focused, and we will. And just because we're transitioning and Emergency Management Victoria are going back to concentrate on other matters, they haven't left us. We're still in contact with them, we still engage with them, and that support's always there, and the state government support in general has always been there, and we can ramp that up again if we need to. I've got to give a call out to the community though. The food share network has been superb. The Lighthouse combination with GV Care has been fantastic. The Priestley family have really led the charge down at High Street, coordinating some food relief there. I've got to give a shout out there. But there are many community groups that have come and helped. There's the normal networks through the schools have been providing contact with their families, and the at-needs families. Through our kindergartens there's been food relief. There's dozens of different avenues where at-risk families have existing contacts, and those existing contacts have been continued to be made. So a great response from the community, and we're quite confident going to the recovery phase that we'll come out of this and get back going as rapidly as we can. I think I'll leave it at that for any questions.
So is it council leading the charge with this recovery phase now then?
Recovery phase will be council, that's correct. We've partnered with other agencies in relation to the relief and in some regard the response, but there are other lead agencies in the other areas.
In terms of that recovery phase, do you see that coming in now? Is that where you're looking?
Yeah, we're starting to have meetings now, and that'll ramp up. And these three aspects of emergency sort of do tend to overlap, but they do come with the response first.
In terms of what the city might need going forward, is there discussions going on about potential, funding or grants that the city might need to get back on its feet?
Yes, there are. So take Food Share, for example. They're with us 365 days a year. We have vulnerable families in our community 365 days of the year. They do a fantastic job. They need support so that in future they can continue to have that great response, but can more easily gear up for an emergency such as this, because let's face it, COVID's been with us for a while now and it's probably not going away in the short term. So that's one area where we will be asking for support, and we've already done that, and government's listening to us on that. Yeah.
The recovery phase, how long are you expecting that might have to last for?
Look, it'll probably have an initial period of 2 months or 3 months or something like that, but recovery really blends into our everyday work, and local government really is a sort of supportive agency that does that recovery work every month of the year.
You spoke about the business forums that were held. In terms of what the local businesses are telling you the impact has been on them, what are they saying that they will need?
Yeah, look, businesses in some regards have done it really hard, depending on the business that you're in. But they're in the same situation as Matt with furloughed staff. 25% of skilled staff in industry in Shepparton has been furloughed or quarantined. So that's probably their main issue, is to get staff back and going. And I know the health response has been very receptive to that, with having the health professionals recategorise and look at the tiers and that sort of thing. So that's probably the main thing that they need, is staff back so that they can get going, and then further business support after that. There's been government support for deep cleaning, for example, and councils added to that support in that regard. And that'll progress as we go forward, so anything else that comes forward we'll try and help with as well. All right, thank you.
Thank you, and if I could just probably reiterate what Peter had to say. The community has really responded in the most remarkable way to some mammoth challenges around particularly relief, as the Shepparton city has lost a significant part of their workforce as they've been dealing with this outbreak. It's been quite a challenge, and I think the city has risen to that challenge. Certainly happy to take any questions, and thanks to everybody that supported us. We work as one in emergencies, and I think this is an exact example of that. We have worked as one, and we've worked well as one.
So does this mean that your role here, I guess, is effectively wrapped up for now?
Look, it never fully wraps up. We're always here in support to the regional and local layer. Whilst there's many challenges at state level, as Matt explained, we've still got an outbreak here in Shepparton, so it's not like we can leave. You know, it's always going to be at this time where it is we need to address our key priorities. Certainly Shepparton has got on top of these relief needs, and we will, as I said, continue to support them, but it's been a tremendous effort by the city.
Will you be leaving personally?
Personally, probably leaving for a period of time. As I said, not leaving in terms of responsibility, but we will naturally, of course, if the need arises, be back in person. But it's been an insightful period of time as well, and we learn lots when we're on the ground with a local response. It's always place-based responses that deliver the best outcomes. Communities know their communities, they know what works well. And as I said many days ago when we first arrived, we're here to support the systems that are well in place, not roll in over the top and say do a whole multitude of things differently. We're here to make sure we can optimise what's already working well.
Where's our ADF troops? Are they staying on the ground or are they wrapping up too?
ADF is supporting in a variety of ways to the City of Shepparton, and that includes things like assisting with testing, certainly home visits, and again, as priorities arise, we can constantly work with ADF to make sure those needs are being met. And if it's required, then we help reposition them so that they can meet those challenges. At the moment, we're certainly seeing the work that they've done in relief. The demand is declining, so it's making sure we use the best of those resources while we have them. And there is other needs certainly that are coming to the fore, and Matt explained some of that with some significant days of testing coming forward. So as I said, we need to utilise the ADF where it is that we can utilise them best.
Do you think some of the lessons that you've learned on the ground here in Shepparton will be helpful to other outbreaks should they happen in other regions?
Oh, absolutely. Across the globe, we've never faced anything like this in basically living memory. So everything is a new experience to a degree, and no one emergency is the same. The Delta variant is changing the landscape for us, even how we respond. So everything is a lesson to be learned, and how it is we can take those lessons forward to how we form up, how we arrange ourselves, how we respond, recover, prepare for emergencies. It's everything's a learning experience, and that continuous improvement has to be fed back into how it is we go forward.
Is there anything particularly you will take from what you've learned in Shepparton into other regional areas, I guess, if they have outbreaks quite like this? The trust in and the goodwill of people that are so willing to help, and again I would just say the underlying structures and systems and features of regional and local response are so well known. They're based on relationships, they're based on understanding of what the community footprint looks like. If we were to ever not listen to community, I think it would be a great failing of us, and it's not a new lesson, but it's one that constantly is one that I'm reminded of every time I come out onto the ground as to how it is we respond to emergencies. The response of people within a community is magnificent. Emergencies sometimes bring out the worst in people, but by and large it brings out the best in them, and we need to capitalise on that.
Thank you.
Thank you. Thank you. Take care.